controlled behavior is the next thing we can understand. That there are several signs of this inflammation. It include fever, and there will be pressure changes. There will be difference in urinary output, and there is also confusion. Especially these symptoms are seen in people in ICU. So that is why they give all these things. But I'm not going to too much details. But in most of the cases, there will be fatty liver a problem, and people think fatty liver. Oh, what is a problem there? I have some fat in my liver, and the doctors don't also give much importance. They say, yeah, you take care of your diet, that's it, or you check your cholesterol and triglyceride levels, and we also take it for granted. But we don't know that liver is the most important organ which actually balances all these things. It will give the balanced signal whether to make a moderate inflammatory response or a huge, like a fire thing, and burn down the whole body. So the liver should always be maintained healthy. Now I'll go into the next symptoms of inflammation. How do we know whether we have inflammation? First, there will be a pain. These are the 5 signals of inflammation. There will be heat, and there will be redness. Especially this happens when we have a injury to our body parts, and there will be swelling, and there will be loss of function. This also happens internally, but internally we won't know, and this is what causes all the problems. Inflammation is the one single cause for the whole body's ailments. So this is what they learn in medical textbooks when they do in their medical course, that if the inflammation is in the blood vessels, then it is called atherosclerosis, blockage in the vein, or cardiovascular disease, neurological disorders. When there is high inflammation in the brain, then there is depression, there is memory loss, and loss of function in the body. Then if it is in the liver, fatty liver, obesity, diabetes, if there is inflammation in the pancreas, it leads to diabetes. So all these problems happen, and the core problem, where is the problem arrive, is present, like the worm in the apple they call, or snake in the apple, or poison in the apple. That's a metaphor they give for the whole thing is in our gut. What our microbes are doing makes a huge difference. Now, what are this microbiota? What is this gut? So we have to understand gut is the intestine we have, the large intestine. There are thousands and not thousands, trillions of microbes are there, and they are actually modulating our genetic system. Now, that part is where we have to actually very much focus. Now there are a lot of information coming in the research where they show that intensive care unit, the sepsis and septic shock, all is determined by the gut microbiome. So if somebody is going to be treated completely and they will come out healthy out of an ICU room or not is all dependent on the gut microbiota. Now, what are these gut microbes? They are present everywhere. Microbes are present everywhere in the body, and they are present more in the intestinal region, and that's why the gut microbiota is given more importance. It is present in our stomach, it is duodenum, colon, everywhere, our ears, our eyes, our skin, everywhere. But it is most of them are present in this region of the large intestine. And there are microbes that are good and bad. Now you can see in this chart, if you look at the left side, you can see bottom 90% of the good bacteria or the lactobacillus and bifidobacteria. And there are 10% of enterococcus and the E. coli, and 1% is the fungus and clostridium. So this is basically the picture of the different types of microorganisms present. Now I'm always correlating to our ancient text. Thirumular In Tirumandiram, in the verse 154, he talks about Muppadum Muppatorum Seppa Madilude Koilul Valvar. He is talking about our human bodies like a temple where 30 plus 30 and 90s are living, and they keep Seppan Edu means to correct it. And that's what modern science is saying, that we are 30 trillion human cells, but more than 30 to 60 trillion cells. The microbes are there, and our bodies continuously getting replaced. And if you look at on the right side border I have given from Scientific American article, they are saying the blood and the gut dominate cell turnover, meaning continuously our body is changing every day. Now I am giving you an analogy so that it will make the whole understanding easy. If there is a town where there are equal number of police and the thieves, or let's say the thieves are very less in number and police are there, then there will be less of the robbery in the place, and there will be more peace of mind. The people who are living there, that place will be like a heaven. But if the opposite happens, when the police are low in number and the thieves and the people who are taking energy or money from other people are more, naturally it will be a panic situation. You will be always living in fear. So it is a balance of the police and the robbers in a place that determines how safe it is. The same way our health is dependent on what is the ratio of the good bacteria and the bad bacteria. If the good bacteria is high or in balance, we call that condition as eubiosis. And if the condition is imbalanced, more bad bacteria are there, then it is called dysbiosis. Now, food is a major thing that determines who are we feeding. What is a good diet? The good diet is the one that feeds the good bacteria. What is junk food? What is bad food? Those food that actually feed the bad bacteria and allow it to grow, they are the bad food or junk food. So now it is very easy to understand what is a good and a bad food. And that is where the terms comes like prebiotics and probiotics come. So now when we eat food that will allow the good bacteria to grow, which are mostly fruits, vegetables, whole grains, and they all will be rich in polyphenols. Those polyphenol rich diet is the one which will correct the good bacteria or allow the good bacteria to grow, and they become the prebiotic food, meaning those food will allow the good bacteria to grow. But if you take directly the good bacteria like yogurt, curd, fermented food like fermented rice, then you are directly taking the good bacteria. They are called probiotics. Both are needed for good health. Now, what determines our body or the biosis and dysbiosis is based on several factors. So it depends on how rich polyphenol rich food we are eating, meaning if a food is rich in polyphenol, means it will be definitely whole foods. It will not be refined. It is not the white rice that we are supposed to eat. We are supposed to eat the red rice and the black rice. And we are not supposed to eat the white sugar. We are supposed to eat the unrefined sugar, the vellam or gur. Then we are not supposed to eat refined oils. We are supposed to take unrefined chekku enne or cold pressed oils. So wherever the polyphenol rich food is there, then that will help the good bacteria to grow. But that alone is not the will determine. One may be eating good food, but if there is severe stress, that will change the gut microbiome. If we take unnecessarily antibiotics, now what happens is for temporary fix, yes, we need antibiotics. But what are we now doing? Simply overdosing with antibiotics and killing the good bacteria. Of course, aging will cause, then other factors of our birth, whether we are born in C-section or in vaginal or delivery, all this matters. So this is generally the basic for to understand how food, what is the best diet, how do we know, and that's what already I said, doing these tests, and we are also now coming up with even directly testing the stool also. We are doing the microbiome test, where what is the ratio of good bacteria and bad bacteria we have. We have been testing for several people, and we found people who had chronic illness for a long time. They were not getting well with allopathy, homeopathy, ayurveda, siddha, and they're frustrated. Then they come to us, and then when we ask them to do these tests, naturally these are all haywire, and then the stool test will say they have a huge level of bad bacteria. So then we give suggestions to correct it, and that's what now Western research also is coming up with, what the oncologist should know, and they are suggesting now, even 2 months back again, British Journal for Cancer, they have suggested that dietary fiber is very, very important when somebody undergoes all these treatment, whether it is chemotherapy and radiation therapy, because radiation and chemo will cause dysbiosis. If you go into the papers, they are clearly saying that, and that is why when they do chemo and radiation, again I'm not saying that do not do chemo or radiation. Yes, it is a temporary fix, but people think that's a permanent fix, and they don't do the real fix, then they are in trouble, and then the disease returns. But people who take more than what these temporary fix, then they live for a long time, disease free even. So this is for all diseases, whether for sepsis in ICU, diabetic, high blood pressure, or it is for somebody who's within cancer, or even any disease, you name it, they are now connecting to the gut microbiota, which really goes to the ancient saying that food is medicine. I'm not going to again details, but this is what the British Medical Journal says. What the cancer doctor should know is that they should be giving the right therapy, that is give plant polyphenol. If you look at the right side, plant polyphenols, dietary food and fermented foods. And now this is what unify treatment for almost 35 years we have been insisting, but people were not following it because they think that something magical medicine is going to cure them. That never happens. And that's what now we see the reality, that modern research is proving that. And this side, on the left side, they are saying if it is needed a temporary fix, do fecal transplantation. You will be shocked to know what is fecal transplantation, like blood transplantation or transfusion. When somebody doesn't have blood, enough blood, they will from a donor, they will take the blood from him and put it in his body. Fecal, they are doing the same thing. If you don't have a good gut microbiome, you are forced with eating the stool or feces of a healthy person. So they put in a mixie or a jar, they completely make it like a juice, they add vanilla flavor, chocolate flavor, what the patient desires, then through their syringe they feed it through the food pipe. This is not a joke, this is the real thing happening. A few weeks back when I was doing the Malayalam talk, our friend Pradesh confirmed that his wife is a nurse in Iowa hospital, and she tells that this fecal transplantation is happening in their gastroenterology department every day. But look at our tradition. The same, instead of eating somebody's feces, we were taking the products of 5 from the cow, which is a pure vegetarian. It is not like other animals eating any junk. It will eat only grass and herbs, and it will give the most nutritious and polyphenol rich milk. But unfortunately, we have seen that in AMMAGENOMICS lab, we tested for milk. Most of the milk, even A1, A2, they are saying, but they are cheating. Some of the companies are cheating the public. Some of them are genuine, but they don't have good polyphenol in their milk. So again, it is not very healthy. Now coming to Panchagavya, they take small amount of cow dungs microbiota, they take the cow urine, they take the curd, which is lactobacillus, and the milk and the ghee. These 5 things are given, and that is only given when in a critical condition by an ayurveda or siddha doctor. But every day we are supposed to take buttermilk, because that is the everyday gut microbiota resetting healthy recipe. Every day in Indian tradition, whether he is a North Indian or a South Indian, every day we will be taking the buttermilk. That is the probiotic we have to take every day to keep our gut microbiome very, very healthy. Again, because of time, I will rush up with the information that there are several cases where from deathbed, when people are told that they won't live more than a week or a month, we have cured them using Panchagavya. This is a case of a lady in Kerala in 2018 from after undergoing chemotherapy and radiation. She completely collapsed. She was in urinary, they were put in urinary bag. She could not wake up, she could not get up, she could not eat. She was given in food pipe, and the doctor said not more than 1 week, and she was in the last home care facility, palliative care center. But we helped her completely become normal, as we see in the rightmost side. Step by step she improved by giving Panchagavya, which instead in US they give fecal transplantation. Here we gave fecal transplantation from a cow's, not just the feces of cow, but along with a very ingenious method, all the 5, and she recovered like anything. But after 2 years, again, it is the family members, they will corrupt the good mind of us. I'm very sorry to use that negative word. Family and friends, they forced her to eat non-veg. I said for 5 years you cannot eat non-veg until your gut microbiome becomes stable. But she did not listen because the force from the people. She ate, and quickly the microbiome changed, and she died very, very soon before we could do anything. So 2 years she was cancer free. But there are people who, last time also I mentioned, like Tanigai, his mother, who got breast cancer in 2011 or 12 and was undergoing chemotherapy by in a famous, very popular hospital in Chennai. And she was sinking, but then after taking the Panchagavya, even now 10 years she is still alive with very good health. So all these are now coming up with, I'm sorry to rush up now with these slides, where there are information coming out where in breast cancer, when the receptors are negative, they say the chances are very low. Even doing chemotherapy, it won't help, but people blindly go for it and they die very fast. But instead, there are research showing that if they do correction in the gut microbiome, they can be completely be cured. But people don't listen to all this. So this is the overall view of what really happens. When we keep our gut microbiome healthy, our immunity becomes strong. We think immunity is by taking some vitamin capsules or tonics or special foods that they sell in net and in TV ad shows. They are not really. They do temporary some benefits. Definitely vitamin supplements and everything will give a temporary benefit. But long lasting, they are going to really change your gut microbiome. It is by eating whole foods that you will be able to have good immunity. So there are again information is pouring out. Even if somebody has a spinal cord injury, we all think, okay, I have to take some surgery. If there is a knee problem, arthritis, I had to undergo knee replacement surgery. But now more and more research are saying that more than all that, you have to change your gut microbiome. Again, if we have done so much damage to our body, naturally our body will get damaged, and that's what we measure by doing MDA test, melandialdehyde. Like when we cut an apple, half the apple, if we apply citrus juice like lemon juice, it will not brown. But the other half, which we don't apply, it will get brown in color, and that is what we call as oxidative damage. Now our cells also shrink like that, and that is why we age. So antioxidants are the ones which will prevent the damage. It is like rusting of iron. Any iron table we have, iron gate we have, any iron thing we have, it will definitely rust because of oxidative damage. We are also like that, iron rusting every day. But by painting, we can increase the shelf life. Same way, if we take this antioxidant rich food, polyphenol rich food, we can minimize the damage and diseases. And that's why we are always recommending these type of foods. We at AMMAGENOMICS not only test in human, but also we have started testing the foods. We have got foods from homemade food, sweets, savories, and from the very popular sweet shops in and around Chennai. They are very, very unhealthy in high melanaldehyde and very low in polyphenols. But the homemade ones with the tested ingredients, that alone are really healthy. So traditional food with sugar and all these oil fried items are not really unhealthy as the doctors or Western research say. They are healthy if we do in the traditional quality of food, which means the sugar should be having high polyphenols, the oil should have high polyphenols, high antioxidants, all the ingredients should have high fill. Then no problem in eating these things. But if you don't have these things and then make sweets or savories like this, definitely it is bad for health. So we have tested all food products, more than hundreds of food products, and also oils, milk, ghee, name anything, tea powder, coffee. We have tons of research information for the benefit of the mankind, our society. And these are the models of reports that we give to people who are taking polyphenol tests. You will see we can talk hundreds of people getting benefited by doing these tests, not just only doing some sugar test and cholesterol test, but continuously monitoring their diet and the gut bacteria directly by doing blood test on polyphenol, because polyphenol levels will tell indirectly how your gut microbiota is. If the polyphenols are high, naturally your gut bacteria will be better. But if it is bad, another way is directly testing the stool, which will reflect the gut microbiota. So these are the tests we do not only for microbiota in the stool and blood, we also do in urine samples, vaginal samples. Women who have infertility problems, they undergo IVF and they fail and they don't know what's the reason. We help them doing these microbiota test in their vaginal region, and then we show whether it is the good bacteria and bad bacteria is in biosis or eubiosis. So all this is possible by doing certification also. We cannot trust all these regular certificates. We see health claims, so we do our own food testing and certification, and only the tested products are brought to Kapilanalam. Our friends have formed that, and our family also buys from that because they search for the best food high in polyphenols and antioxidants and low in MDA. And this is their website. And the take-home message for today is consult your doctor, whether it is allopathy, ayurveda, siddha, homeopathy, whatever. You first pay attention to your body symptoms. Always listen to what your body is telling. Any ache or pain, don't immediately panic and think that you have some problem, but see how you can help your body first. You should be the first doctor. You should be the one who have to take in charge of your health. Then you always take an external health. And that is why we call in Unify the 5 needs of the body. So we also give personal free consultation in our WhatsApp, not in the WhatsApp now, it is in Telegram. We also give personalized consultation. We do pre-pregnancy courses. We do natural toxic-free living. And we also continuously do specific topics. What are the specific foods to be used for food for different diseases. And we have done this very long back. You can see here in 97 itself we talked about all these things before the West was talking in too much on this. So you can see we in this 97 book itself we wrote on polyphenol compounds, isoflavonols. This was in Tamil, and we had done this very, very early. But at that time we did not have the lab or procedure to help the people. Now we are fortunate with God's grace, we are able to do in the lab. So again, I am mentioning that we also publish books. More than 2,000 pages are in our website. Apart from that, we have published very good books like Virudha Ahar, which are the good foods and what is the best combination of food to be eaten. So it is, all this is like a holistic approach. We do from Shakti Foundation the right awareness program. In AMMAGENOMICS, we do the diagnosis and the food testing, and also we help people to find the tested good products from the best farmers we have. We also have to help the farmers who make this honestly good food, and if we don't encourage them, then we are the losers and we are going to pay heavily for the price by losing our mental peace. Thank you very much for this patiently listening to the talk, and I've taken more than 56 minutes, but I'm open now for questions.